Can start now. Chatting aside, ma dekha છે. Good afternoon. Welcome to this FB live session from Buyer for Women. And let's say all together, I'm fine. So, good afternoon, everybody, and welcome to this session on myths and facts about PCOS. I'm Dr. Beenal Divyesh Shah. I'm a gynecologist and a laparoscopic surgeon working at Dwarkesh Hospital for more than 20 years. And I'm also fondly called as Wonder Woman of Vadodara. 91.1 has given me this title. So I'm happy to share my knowledge about PCOS in this vast experience of gynecology. I have seen PCOS or polycystic ovarian syndrome, which is a disease entity which used to be a rare entity in the years back, but now it is becoming very, very common. Right? So first, to know what is PCOS or PCOD, let us first understand the normal female menstrual cycle and the reproductive system. Every female has a uterus and 2 ovaries, right? The ovary is responsible for developing and ovulating an egg. So normally, as all of you know, that in the middle of the cycle, a mature follicle ruptures. That is called ovulation. And if it gets fertilized, there is pregnancy. And if it doesn't get fertilized, by the end of the month, that is 28 to 30 day cycle, most of the ladies get a menstruation. So this is what happens routinely in most of the females. So what is PCOS? PCOS is basically a hormonal imbalance because of which there is an imbalance between the follicle stimulating hormone, LH hormones, and due to that, the follicles or the eggs in the ovary, they do not become mature. They do not develop fully. Because they do not develop fully, like they don't reach the mature size of 17, 18 or 20 millimeters, they stay half developed, somewhere around 8 to 10 millimeters. Now these half developed eggs, they do not ovulate. Okay, so they do not rupture. Because they do not ovulate, there is no ovulation, and because of that, resulting into irregular menstrual cycle, right? So in a simple language, PCOS, PCOD, it is the same thing, that is polycystic ovarian syndrome or polycystic ovarian disease. It is a common health problem in females and it leads to irregularity in the menstrual cycle. And obviously, because there is no ovulation, it often leads to fertility issues. Fertility issues means the female is facing difficulty when she wants to plan a baby, when she wants to become pregnant. And initially we used, as I said, that we had a prevalence of somewhere around 10 to 15%, but now with the sedentary lifestyle and the eating habits, we are seeing an increase in the prevalence rate of approximately 20 to 30%. So that is very alarming, and that is why we thought that it is a key issue which requires awareness among today's women, right? So polycystic ovarian syndrome is quite common, as we said, and I have seen that it is increasing. Now, somebody would ask me that, okay, if a sonography report shows polycystic ovary, does that mean that I am having PCOS? No. Only one criteria cannot diagnose that you are having PCOS. There are a number of criteria which are required to diagnose as a PCOS. So one question is that what are the symptoms of PCOS? Like how would any person come to know that this girl might have PCOS? So the most common symptom of PCOS is irregular and infrequent and scanty menses. Like the lady will get menstruation, let us say once in 1.5 or 2 months, 3 months, and she'll get the flow which is very less, like 1 day, 2 day, and a scanty flow. So that is the most common complaint of PCOS. Even we have seen females who have to take a tablet to bring the menstruation, like it does not come spontaneously, right? So infrequent and irregular menstruation is the most common complaint. The other complaints, as I told you, is the difficulty in becoming pregnant. Like she plans to become pregnant, but she is not able to become pregnant. She has excessive facial hair, like she has hair at unwanted places on face, like just like a male pattern, like she'll have face in above the upper lip, near the beard, right, on the chest. So a male distribution of hair, and she'll have hair at unwanted place, and at the same time she will lose the hair from the scalp, like where she requires hair she will start losing hair from there, right? So thinning or excessive loss of the scalp hair is also one of the symptoms. Again, a very commonly seen symptom or a sign is rapid weight gain. Like 80 to 90% of females who are having PCOS, they have excess weight, they are obese, right? And again, they have difficulty in losing weight. Like they need to put in much more extra effort than the other person to reduce weight, right? Another symptom because of this is because of the increased androgens, there, as I told you, there is an imbalance in the hormones. There is an increase in the male hormones, that is the androgens. So that leads to acne, that is pimples, oily skin, and hirsutism we discussed. So all this finally leads to a lot of depression. It brings down the female's self-esteem. Like she is not very confident about her own self because of like excess weight gain, excess facial hair, excess pimples, and irregular periods. So it is quite a frustrating scenario, and it often leads to depression. She is not able to conceive. So all these lead to a symptom complex. But mind well, every woman has a different symptom. So it is not necessary that every female will have the same symptom. The proportion of the symptoms may vary, and somebody may have one problem which is more severe than the other, right? And yes, it definitely differs with the age. Like in the younger age group, your main concern is about the excess facial hair, the weight gain, irregularity in the periods. Now, as the age increases, the PCOS doesn't go away, but it presents in a different way as a metabolic syndrome, as a central obesity, hypertension, diabetes, right? So basically, it has varied presentation. Now, one person has asked me that does PCOS lead to diabetes? Yeah, so frankly, diabetes and PCOS are interconnected because in PCOS, because of the hormonal imbalance, there is insulin resistance. Insulin resistance because the insulin is being secreted by the body, but the body cells don't respond to it. So what happens? The body keeps on making more and more insulin. So because of this insulin resistance, often the pancreas get exhausted, and the patient who has PCOS has a tendency to develop diabetes in pregnancy or in earlier life, like rather than the later age group. Yeah, a female with PCOS can have diabetes in the young age group, right? And one person is also asking me that can I get rid of the PCOS if I lose weight? Right now, we'll come to the treatment later. First of all, we'll discuss that what are the problems associated with PCOS, right? The PCOS is leading to depression, leading to infertility, obesity, and the problem doesn't end there. Even after you conceive, don't forget that you had PCOS and try to maintain a healthy lifestyle, because later on it can cause endometrial cancers as well. Right now, coming to the main point, that how do I diagnose that, okay, I have PCOS? So first and foremost, as I told you, the clinical examination, that is the weight, excess weight, excess facial hair, pimples, even skin discoloration, that is called acanthosis nigricans. That is, the patient of PCOS often has a dark skin in the underarm and at the back of the neck, right? And plus hair loss in the scalp hair. So these are the examination findings. Then the doctor might recommend you ultrasonography. The ultrasound tells us that there is no other problem in the female with the uterus and the ovaries, and a typical polycystic ovary on ultrasound looks like a necklace of beads pattern. Like, the ovary looks bulky, normally bigger than the normal ovarian size, and there are small follicles which are, as I told you, they are half developed follicles. So they just keep on getting collected in the ovary. They do not mature fully, they do not ovulate, and these half developed follicles, they keep on getting collected in the ovary. So that is a typical polycystic ovary or the PCO, right? And that is what is seen on the sonography. And then the doctor might recommend you certain blood tests, right? Blood test is one thing we always want to rule out hypothyroidism or thyroid problem in a female who has irregular periods. Plus, we'll go for the hormone checkup, the androgen levels, the sugar levels to rule out diabetes, and the certain hormone tests will be required to be done. These hormone tests will reveal that there is a hormonal imbalance or an androgen imbalance. So all this together, the clinical examination, the sonography, the blood reports, everything together will help the doctor to diagnose that a lady has PCOS, right? Now, PCOS doesn't mean that you will not become pregnant or something, or it is nothing like to be depressed about, but yes, it is something which you have to deal with lifelong. Like there is no complete cure for PCOS. You just cannot get rid of it totally, but yes, don't be depressed. You can definitely keep it under check, under control. You can control all your symptoms, right? So basically, the main treatment of PCOS is in your hands, and lifestyle modification is the basic key to the treatment of PCOS. Lifestyle modification means weight loss and then maintaining that weight loss, right? So weight reduction, being in the ideal weight for your height, with the help of diet and exercise both, and then maintaining it lifelong, right? So we'll talk a little bit about the lifestyle modification and then we'll go further. Now, by weight loss or weight reduction, I don't want you to go for any crash dieting because it is unhealthy, it is not advisable, right? So mainly you will have to have a low carb diet, low carbohydrate diet with approximately 20 to 30% of deficit, which is required for your weight, and plus a regular exercise schedule, minimum of 40 minutes of exercise per day, 5 to 6 days a week, right? And exercise better be a combination of aerobics and yoga, like yoga as is the gift of India to the world. And I feel that yoga is a very balanced exercise in form of holistic health for women because it calms down the mind. Often the PCOS female is quite depressed, so it helps her to calm down her mind, regain her confidence, develop the tone, the flexibility, and the stamina. And plus aerobic exercises help to burn the calories faster, right? So always go for a combination of yoga, and there are certain yogasanas which are beneficial for PCOS. Specifically, let me tell you the sun salutation, that is the Surya Namaskar, the Chakki Chalan Asana, the Supta Bandha Asana, the butterfly pose. So all those yogas are specifically designed to be effective on the pancreas and the insulin resistance, and they are helpful for removing the central obesity. So that helps in PCOS. Again, aerobic exercises for the young females, I would like them to, pursue something which you love. For example, suppose you enjoy dancing, then take up something like Zumba or, something like a dance on the Bollywood steps, something like that, which you really enjoy. You don't feel as if it's a punishment, because if you enjoy, you will do it longer. And that is what is required, because here there is nothing like a, quick fix. Like there is nothing like you do a 2-3 months medication from a doctor, you do a few exercises for a month and you are rid of it. No, this is something which you need to continue lifelong. As I told, a lifestyle modification. So do something which you enjoy and which you can pursue and you can do for a long run, right? So don't enroll for a gym for a month and then leave it. Otherwise, all the weight can bounce back, right? So basically, these are the lifestyle modifications which I would recommend. Just sum up again: a healthy diet, avoid junk food. So now the major culprit of why we are seeing increasing number of PCOS patients is increase in the junk food, especially all the refined flour products, that is maida. All the refined flour products like, pizzas or burgers or noodles, everything have excess calories, and all these come in the junk food category, plus like fizzy drinks, excessive sugars, sweets, and you avoid deep fried things like oily stuff and wafers and chips and all those things. So mainly junk food needs to be avoided. As I recommended, I'll again repeat, minimum 30 to 40 minutes of exercise per day, minimum 5 to 6 days a week. right? And you need to lose a weight. Even like, don't be, kind of try to put a easy or a lucrative or a very, you think that it is a very doable target. Like, even if you lose 5% of your body weight, you are doing great help to yourself. Even that 5% weight loss in you will try to regularize all the hormones. The hormonal imbalance starts getting corrected. You start getting regular periods. You can easily become pregnant as well. Okay, so don't lose hope and try to put a target which you feel is very much doable, right? And definitely once you start losing, your confidence will build up, right? So don't give up and keep doing it, and reduce the amount of excess sugars and salt and caffeine intake in your diet, right? And now coming to the treatment options, like what are the treatment options? Do we have the same treatment for all PCO patients? No, you have to tailor made the treatment. Plus you have to see like what age group category the female belongs, like whether she is a young unmarried girl, whether she is a married girl who wants to become pregnant, or whether she is a middle-aged woman, she's done with her pregnancy, now she just wants a regular cycle, right? So age group of the female, whether she wants to become pregnant, how much overweight she is, or they may be 5-10% females who are lean, like thin PCOS, right? So again, their treatment schedule will different. So treatment options are different for different females. The first thing in the treatment comes is lifestyle modification, which we already just now discussed. Second, treatment options with the help of a doctor. You can take help of medications. There are certain tablets available, and they are similar to the birth control pills. So don't be, kind of bugged up that why a doctor is giving me birth control pills. Basically, these are hormonal pills which help to regulate or balance the hormones which are imbalanced in you, right? So even if a unmarried girl is being prescribed a birth control pill by a doctor, the parent or the girl should not be worried. And basically these hormonal pills are used to control the excess male hormones. So they try to control the imbalance of hormones in your body. They reduce the androgens. They regularize your menstrual cycles. They reduce the excess growth of, there are specific hormones, specific progesterone in these pills. This helps to reduce the excess facial hair, and basically also they'll help in making the skin more clear, like getting rid of pimples, reducing the excess oiliness of the skin, right? And also because of the birth control pills, if you get regular periods, it reduces the chances of endometrial cancer. Because if the girl doesn't have period regularly, the endometrium, the inner lining of the uterus, it keeps on building up. Suppose a female doesn't get periods, so an inner lining is not getting shed off. So a month by month, it keeps on building up, right? So basically, these birth control pills can also be used. There are any other medications also like myoinositol, vitamin D, so the antioxidants. So these are also helpful for the treatment of PCOS. So treatment, medical management, definitely you have to take with the guidance of your doctor. And very important is the compliance. Like suppose you take the medicine for 1 month and then you leave it. It is not done. You have to constantly stay in touch with your doctor, be very compliant and regular about your medicines, because that will help you to regularize your cycles. And once you start losing weight, gradually the doctor may reduce the medicines, and once you are at an ideal weight, try to maintain it, and you may be off the medicines as well, right? So this is how you can get help from a doctor to treat your PCOS. Now, another question for me is that if a woman with PCOS, can she get pregnant? So yes, definitely she can get pregnant. She might require some medical help to get pregnant, but she can get pregnant. And the question related to it is that, will the PCOS affect the pregnancy? So yes, dear friends, the PCO female, if she gets pregnant, she has to be more careful, because there are chances that she may have a miscarriage. So she might need to continue the insulin sensitizer medicine and the progesterone support during pregnancy. So the chances of miscarriage are more. There are also chances of that this female may develop diabetes and hypertension during pregnancy. So she has to be more alert, and don't take the things easy that, okay, now I'm pregnant, I can go for my sweets or excess carbs. No, you have to still take care and be on a balanced diet, because the chances of getting gestational diabetes, that is GDM, is more. And some females may have a chance of premature delivery, right? And so that is why, we take these extra care whenever we have a patient who has PCOS and is having pregnancy. And okay, the another question is that can a woman on insulin sensitizer breastfeed? So yes, breastfeeding is to be allowed, and there is no problem. Insulin sensitizer like metformin, you can safely breastfeed the baby. On the contrary, breastfeeding is very beneficial to the mother as well as the baby. To the mother, how it is helpful? Because it reduces the chances of her developing diabetes type 2. It helps her to reduce the excess weight which she had gained during pregnancy. Breastfeeding also reduces the chances of breast cancer. And breastfeeding, it will also benefit the baby. How? Because the baby will reduce the chance of having childhood obesity. It will reduce the chances of having asthma or type 2 diabetes later in life, right? So this is how we can deal with the patient of PCOS and pregnancy. Another question to me is that what are the long-term problems caused by PCOS? So as I've already said, once again, the long-term problems which can be caused by PCOS is diabetes, high blood pressure, and abnormal cholesterol. So be careful that even if you have delivered and you have a baby, don't forget that you have a PCO tendency in your body, because this syndrome is going to stay lifelong. So you need to always be on a healthy diet with a regular exercise schedule. So that will help you prevent these long-term complications like diabetes, blood pressure, and hyperlipidemia or excess cholesterol. Okay, I'll just check the chat box to see what are the other questions there. Okay. Okay, one question is that can you highlight on the hair fall issues in PCOS, and is it curable? Yes. So basically, yes, you are very right. Something which is very discouraging in PCOS is that getting hair at the unwanted places and losing the hair where we want it, that is the scalp hair. So again, this is curable. It can be controlled, but at the same time, you can take help of some hair supplements, hair vitamins like biotin and all. Also check that whether your hemoglobin is right, because if you are low in iron, again, you will lose more hair. Take supplements like B12 and iron. And the another question is that can we take metformin for PCOS? So yes, metformin is an insulin sensitizer. Just as I explained that there is insulin resistance in PCOS. The body is secreting insulin, but the body cells are not responding to it. Right. And that is why you get abdominal obesity. The shape of the body changes. There is a fat deposit on the waist circumference. Right. So in this situation, metformin, which actually is a diabetes medicine, can be given to the PCO patient. There is no harm to it. And in fact, as I told you, the metformin, if the lady has become pregnant once she was on metformin, she should at least continue it for 3 months. The doctor may modify the dose as per the requirement, but it should not be suddenly stopped. If you suddenly stop metformin, the chances of miscarriage or abortion will increase. Okay, another question for me is any side effects of birth control pills, right? See, there are a lot of varieties of birth control pills available. And as I told you, that birth control pills do have a role in treatment of PCOS because they have the hormones which can help reduce the androgens. Androgen means the male hormone, which is excess in PCOS, right? So the birth control pills can be given. Now in that, as I told you, that there are a lot of variety of birth control pills. So there are specific birth control pills which have specific progesterones like spironolactone, which is more beneficial for PCOS. Okay, so the doctor would definitely recommend the specific birth control pills which are more beneficial for PCOS, and they can be safely taken. Nowadays, the pills are very low dose, so mostly they don't have side effects. Sometimes if you are taking it for the first time, you may develop little nausea sensation or headache, but otherwise there is no long-term side effects of taking the birth control pills. Don't feel that if you take those birth control pills you may have problem with getting pregnant or having infertility. It's nothing like that, but you definitely need to take it regularly. If you keep forgetting the pills in between, you can get intermenstrual bleeding or irregular periods, but otherwise there is no harm or side effect of having PCOS. Okay. Now there is another question. I already have one baby. Now I'm suffering from PCOS, some endometrial thickening. Yeah. So as I told you that even once you have a baby, don't feel that you are done with the PCOS. You have to maintain your weight and your lifestyle and your diet and exercise schedule, because excess hormones will if you don't get your menstruation regularly, what will happen? The endometrium, that is the inner lining of the uterus, will keep on building. So ideally, in your case, you can take the help of pills and let your menstruation come regularly and let that endometrium get shed off regularly, rather than allowing that endometrium to keep on building, right? So okay, uh, yeah. The another question for me is how long one should take the metformin tablet. See, now basically how long is again depending on like how well you are taking care of your lifestyle, how well you are maintaining your weight, your diet, your ideal weight for your height. So once you have reached your ideal weight for your height, you may stop the metformin if your sugars are normal. Like if you don't have diabetes and the metformin was given only to help you control the PCOS, you can gradually stop the metformin once you are at an ideal weight for your height, right? Yeah, okay, there is a brand name written that one particular female is using a particular brand name of pills to regularize the period. So as I told you, as such, any OC pill is fine to regularize the period. But if you have PCO, then rather than a routine OC pill, which is a contraceptive, rather than a routine birth control pill, there are certain birth control pills or which have certain molecules or certain progesterone, that is saproteron, or those molecules are more beneficial for PCOS, right? So rather than taking a routine birth control pill, if you take a pill which has certain molecules like drospirenone or saproteron, they have more benefit. So if you take that, you will get both benefit. You will regularize your periods. You will also, they have anti-mineralocorticoid effect. So they will reduce the androgens. They will reduce your chances of getting blood pressure, diabetes. So you will get more benefit from that same pill, right? So only not regularizing the period is our target, but we also want that the metabolic syndrome in our body gets corrected. If we want our body getting corrected from within, right? So that is it. Okay, now one lady is asking me, explain about dermoid cyst and whether laparoscopy is required to remove the PCOS cyst. Now see, PCOS, some female tell me, come with a sonography report, they are so frightened, they tell me that, madam, mere ovary mein cyst ho gayi. But see, PCOS, polycystic ovary, agreed, the name has cyst, but these are very, very tiny, tiny follicles, which are less than 1 centimeter, like they are, 8 to 10 millimeters. They are very small, tiny follicles, like they are just 8 to 10 millimeter size follicles, and they are half developed follicles. As I told you, for a follicle to rupture, it should become of a mature size, like 18 to 20 millimeter. Rather than that, what is happening in PCOS? The small size follicles, they just become atretic and they stay that size. Now, these cysts doesn't require removal. Okay, we do laparoscopy for PCOS, but we don't remove the ovary or we don't remove those tiny cysts. But what do? We do laparoscopic ovarian drilling. So not in all cases, but in certain cases who are not responding to medical management, who are having difficulty in becoming pregnant. So in those patients, we do LOD, that is laparoscopic ovarian drilling. Means with help of laparoscope, that is keyhole surgery, I put in the scope from the navel. From the side cannula, I put in a needle with the electricity, and that will puncture those small follicles, and along with that, it will destroy a little bit of the ovarian cortex. So what will happen? It is a surgical treatment for PCOS, and it will try to correct the hormonal imbalance. Okay. And dermoid is a totally different thing. Dermoid cyst is something which develops from a germ layer. So no, that is not the discussion of point today, right? Okay. Another question was regarding a healthy diet. Yes, I'll come to the diet again. Let me just scroll through other questions. Yeah, ma'am, I got very heavy periods and it is also PCOS. Yes. So you are right in your question that initially most of the females who have PCOS, they do have scanty menses or irregular menses. But sometimes in PCOS, you can get very heavy periods also. Why? Because once you get irregular periods, as I told that every month the endometrium needs to get shed off. The endometrium develops 10 to 12 millimeter thick and then the bleeding happens. Okay, but if you don't get your periods monthly, what will happen? Every month the endometrium gets more and more thicker. Now this hyperplastic endometrium, when it starts bleeding, it will bleed heavily. So some patients of PCOS, once they get periods in once in 2-3 months, they can get heavy bleeding also. Uh, One female is asking me that I have irregular periods, I have PCOS, but no other symptoms like no excess weight and nothing. So that is good that you don't have an excess weight and you may be having, you are one of the ones who are less frequent. That is, I told you that approximately 10% of female of PCOS, they are thin. Otherwise, 80 to 90% of females who have PCOS are obese, right? Another question is that a woman with PCOS can never get pregnant? So it's a big no. And I already told you that you can become pregnant. So don't be disheartened. Only again, lifestyle modification, ideal diet, weight reduction, and certain medications, and the doctor should be able to help you. Mostly the medical management will work most of the times. Rarely a patient may require laparoscopic ovarian drilling, and then definitely she can become pregnant. Right now, another very interesting question related to the current scenario is that has the pandemic caused increase in the PCOS? So in a way, yes, because what happened in the pandemic, because of the lockdown, the people, the sedentary lifestyle of the people increased, especially the adolescent girl, the teenagers, like they were not going to school, college, so all the time they are confined in the home, right? So yes, we have seen there is an increased rise in the PCOS, and specifically the excess weight gain is there. Again, sedentary lifestyle, making new recipes from the YouTube and all those things, and eating a lot of sugary things, so that has increased the PCOS or the obesity. But again, it is in our hands. If we even at home, if you can continue doing your workout, your exercise, if suppose the maid is not coming, you can do some household work as well. So it is basically your own temperament or your own thought process, that if you have decided that okay, I must walk 10,000 steps, or I must do this workout, or I must eat healthy, you can tackle everything, right? Now, the question is that is PCOS causing the thinness of the uterus? No, that is a totally myth. PCOS doesn't cause thinness of the uterus. The uterus remains the same. PCOS, because of the delayed cycles, it can increase the thickness of the inner lining of the uterus. But there is no thinness. It can increase the thickness of the endometrium, that is the inner lining of the uterus, right, which gets shed off in form of menses. One question is why PCOS happens to adolescents. So basically, it is not that it is happening to adolescent. It is when you come to know that okay, she might have PCOS, because it is the time when she starts manifesting. Okay, because the main symptom of PCOS is irregular periods and scanty periods. So only once the lady starts having menstruation, you may come to know that okay, she is having irregular menstruation. And by the way, initially you have to give her some time. Suppose a young girl, 13 years girl gets periods, doesn't mean that she'll start having regular periods from day one. Okay, or from the first month itself. So you need to give 1 to 2 years for the hypothalamo pituitary axis to get mature. So approximately after the age of, let us say 14 or 15 years, or approximately after 2 years of her menarche, she should start having regular periods. So if still she has irregular periods, less periods, she's putting on weight, she has unwanted facial hair, she has excess pimples, then you might think in the lines of PCOS, right? Yeah, one question is it safe to take medication continuously for excess and unwanted hair? Yeah, now this is a good question, and in a way, you are right that we can definitely control or reduce the excess unwanted hair. As I told you, that there are certain birth control pills which have certain molecule like cyproterone, which will help to reduce the unwanted facial hair. Like once you start using those medicines regularly, you will see the hair which was coming very thick and coarse, it will start becoming very fine. Suppose that lady required to do threading, let us say every 15 days, now she needs to do threading once in a month. So you will start seeing the response. Some females, we also advise laser depilation or laser hair reduction, because as such there is no other treatment for that. And I feel that there is no harm in doing that, because in a way it helps to boost the self esteem of a female, because cosmetically it is very disfiguring to have unwanted facial hair. So there is no harm in taking those medicines for excess facial hair, or even taking the laser treatment for the excess facial hair. So I'm scrolling down the chat for the other questions. Meanwhile, if you have any other questions, you can put in fast. Okay. Okay. Another very nice question is that, do I need to worry about PCOS if I do not intend to get pregnant? So yes, my dear, I will not say that you need to worry, but I'll say that it is a matter of concern, or it is a matter which you should not neglect. Okay. So even so, pregnancy is not the only target of a female's life, right? Finally, we want to have a holistic health, a good, healthy and happy lifestyle. So as I told you that PCOS can have problems in getting pregnant. At the same time, PCOS has other long term implications also, right? A person with PCOS, there is more chances that she'll put on weight. Excess weight, obesity is again a root cause of other chronic illnesses, right? Plus, a person of PCOS has more chance of insulin resistance and developing diabetes in future. A person of PCOS has more chance of dyslipidemia, means the cholesterol gets imbalanced. So obviously there are chances of heart disease. Suppose you're not getting your periods regularly and the endometrium gets thickened, there is a chance of endometrial cancer as well. Okay. So all this I'm not saying to frighten you, but just to alarm you that don't neglect the PCOS. And even if you don't want a baby, or you already have a baby, you don't forget that you have PCOS. But it is nothing like a death statement. It is just something which will, keep you yourself on a check, that a healthy lifestyle, there is no substitute to it. And you definitely need to be on it. Okay. Fine. Now let me go for the other questions. Mm, Fine. What are the chances of teenagers to get PCOS? Right. Now, to answer to this question will be that mainly, depends. There is some genetic influence, and there is like some people have a tendency for PCOS, and that can get aggravated because of lifestyle. Suppose the same female was having a very regular periods when she was active. Now suddenly she is sitting at home, a sedentary lifestyle, no exercise, no outdoor work, and eating junk food. Now she starts putting on weight, and she starts getting irregular period. So often a person with PCOS starts manifesting once the lifestyle changes, right? Okay. I think I've covered almost all the questions. Mm, Okay. Yeah. Another question is that, yeah, ma'am, I want to conceive, but my period is not regular. Yeah. So basically, that is what the problem is in PCOS, that the periods are not regular. So what will happen is that you need to consult a doctor who would test your hormones, also rule out that you have any thyroid or any other issues. If you are having excess weight, then first try to reduce your weight, then plan pregnancy. Understood? So because what will happen is, once you start losing weight and you are in an ideal weight, your hormones will start becoming regular. You will ovulate regularly. Once the egg gets released, obviously the egg can get fertilized and you can become pregnant. And if you become pregnant at a more ideal weight, it is better. Your chances of developing diabetes in pregnancy will reduce. Right. So take help of the doctor to regularize your periods. She might give you birth control pills for a few months and you might be shocked that I want to become pregnant and doctor is giving me birth control pills. Okay. But it may be her way to regularize your hormones, give you some time to lose weight, She might give you metformin if required, that is the insulin sensitizer, and certain supplements like folic acid, B12, vitamin D. So overall, an entire person needs to be treated, and then you can again plan to be pregnant, right? One female is asking, ma'am, मुझे PCOS है 2011 से, so almost more than 10 years. मैं 30 एज की हूँ, बेबी है, but एक्सरसाइज करती हूँ अभी. ओके, fine. And yeah, so she has slightly overweight. She is not excessively overweight, but she is slightly overweight. So what I'm trying to say is कि आप जो कर रहे हैं वो अच्छा कर रहे हैं, और आप एक्सरसाइज वगैरह चालू रखें, अपनी डाइट का भी ध्यान रखें, बहुत कार्ब्स ना खाएं, मतलब मैदा, बहुत चीनी, तली हुई चीजें और फास्ट फूड है, बेकरी प्रोडक्ट्स हैं, तो ये सब चीजें ना खाएं. एंड इट इज गुड दैट यू हैव अ बेबी, और अगर आप सेकेंड बेबी प्लान करना चाह रहे हैं, so that also you can as per the time pursues, right? One question is that okay, I have Mirena coil. Do I have chances to get PCOS? See, Mirena क्या है? एक प्रकार का टी डिवाइस है जिसके अंदर दवाई है. There is a medicine inside the Mirena, levonorgestrel medicine. That medicine is being released. So Mirena will basically help you to regularize your, मतलब reduce your heavy blood loss, menstrual blood loss. Okay, Mirena, the main indication we use Mirena is that one lady, any lady who has heavy menses, we put in a Mirena. So that Mirena is basically a levonorgestrel containing intrauterine device. So it is thin the endometrium, and that is why the lady will have less menses. And second use of Mirena is that it will also help as a contraceptive. Okay. Now this Mirena will release that hormone only locally. Okay, so it has effect only on the endometrium. This Mirena is not going to cause you PCOS. Okay, Mirena is not going to have any effect on the ovaries. Okay, and PCOS is mainly a problem from the hormonal imbalance. The ovaries are not ovulating regularly, right? There is no problem as such in the uterus. Okay, so Mirena doesn't have anything to do with PCOS. One Gauri Kokhle is writing, please answer my question. I think I've answered all the questions, but still I'll scroll back and see. Okay. Yeah. Okay, very nice question is that, ma'am, post-COVID, what is the take-home message for 14 to 16-year-old girls? In fact, my message is for everybody who is listening this, that there is no substitute to healthy lifestyle, and health is truly wealth. And you must have realized this in this COVID scenario, that the ones who are healthy have an edge of the others. Wealth is not going to help you. Right? It is only your health which is going to help you. And for a good health, our body is being designed in a way that we need to balance the exercise and the diet. Right? And sedentary lifestyle is not at all advisable. So rather than staying indoors, you can at least go outdoors. If not on the roads, you can go at least in your house garden or your terrace, or even in a bigger room of yours. You can continue doing some or the other form of exercise. As I told you, do something which you enjoy, something like a Zumba or dance. So it will be entertainment plus exercise, right? So keep doing such things. You can do some gardening, you can do some household work or chores. You can help your mother to do some household work, learn some cooking, but also learn to do healthy cooking rather than making only bakery products or only high calorie food, right? So that is my message. And technology is good, it is very harmful, useful, but the same coin has another side, like it is a double-edged sword. Excess technology, excess laptop, mobiles, it will make your life very sedentary. So rather than that, go out in nature or go for a walk or listen to some music, do some dance. So that is my advice for everybody who is listening to it, because more healthy you are and more close to nature, nature is going to bless you with a good health as well, right? Now, another question is that after laparoscopic drilling, is PCOS cured or will it come again? See, PCOS is something which the tendency is always going to remain in your body. Okay, so it is like that you have to keep it under check. Laparoscopic ovarian drilling will temporarily regularize the hormonal imbalance. So for a while, or let us say for a few months, the hormones will be balanced, and that is why the lady starts getting ovulation regularly. It may help her to become pregnant. Okay, but that doesn't mean that PCOS has totally gone away. And the later, obviously, that female has to always keep her lifestyle in check, right? One female has asked that I have PCOD from 8 years and I did 2 IUI cycles which have failed. So what do I do next? Now, basically, we need to go into a lot of details of your reports, that what exactly is the problem, whether there is any blockage in the fallopian tube, and there are many other problems for infertility. So your doctor will be able to guide you better, right? Okay. Yeah, I think I have answered almost all my questions, and I hope you found this session useful. Yeah. Yes, you are right. One of the lady has written that with healthy diet and exercise and with medicine, PCOS is curable. Yes, so you can definitely keep it under control, keep it under check, and you can get your desired result, whatever, like pregnancy or regular menses, whatever your desire, you can get it, right? Yeah. So mostly I've answered all my questions. So I think, yeah. Uh, yeah, one of the questions again is, can you help me highlight on hair fall issues? So yeah, so I think I've already taken this question, and basically, as I told you, that you can take PCOS medicine, and at the same time you can take some hair supplements like biotin and all, and that will help you to reduce your scalp hair fall. And don't use excessive chemicals, excessive straightening or heating irons on the hair, because any excessive physical or chemical treatment can damage the hair more. Right. So I really had a very nice session. Thank you for the interaction and for your comments and questions, which inspired me to tell you more and more. And I would love to, come back again to you for similar queries on this topic or any other topic of your choice. So I would like to again thank Bayer for Women. Thank you for bringing me on this platform live on Facebook so that I could interact with so many of people. Thank you so much, and nice talking to all of you. Thank you.